Okay, we are recording.
Great. Thanks everyone for joining us tonight. We're going to give you the very minimum amount of information based on what we're using and have been using since 2018 called the fasting mimicking diet. And why is it a fasting mimicking diet? Fasting, as you might imagine, can be very difficult. If you're on medications, if you have a tendency towards low blood sugar, these can be pitfalls. And of course, extreme caloric restriction, which is basically no calories with true fasting or water fasting, is very difficult on the body and sets off a number of mechanisms that almost always, with experience, even with experienced fasters, will rebound with a rapid weight gain shortly thereafter. So tonight's agenda, we'll do a quick introduction. We're going to tell you what Prolon is, why the science of Prolon and the fasting mimicking diet are important. And Katie's going to give you information about upcoming free 5-day virtual group to support you, especially if this is your first time. Next slide. Thank you. What is this? What is Prolon? It's a 5-day, it's patented and scientifically backed fasting mimicking diet program that does some very unique things. Walter Longo is the author of this. He wrote a book in 2016 called The Longevity Diet. His primary goal was focusing on the things that help with longevity. Well, the funny thing is that when you focus on longevity, you also focus on elimination of disease and cancer. Cognitive issues have been shown to be helped by fasting. And fasting is the only thing that's ever been tested to show, at least in rats, but that's all we can really test in longevity, to promote longer lifespan. So this scientifically backed program, Longo did his homework. He started many years ago. He searched the blue zones. He backtracked to some of the blue zone locations. He found out what was common. He talked about the diets. And then between his lab in Milan and the UCLA, where they have a very large program there for the fasting mimicking and other lifestyle medicine interventions, they did the homework to find out what is the easiest way to do this and the safest way. So this, you have to take my word for it. The book, it's a couple hundred pages long. It's readily available. But I think you would do well, since we've been using it since 2018. I personally use it multiple times. I think it does make the difference. I've used it with zillions of patients. And it's this term fasting mimicking is meeting the criteria that the body needs to think that it's fasting for a 5-day water fast, but it still allows you to eat food. And what does that do? That allows other nutrients for function. And it also avoids losing muscle mass, because the first thing you lose when you fast is muscle mass. It's not fat. Next slide, please. Next. So the science, so the pathways, you see the little green bars on the right. And we get all these nutrients in the program. And the body can sense that it's getting what it needs, but it's also not getting what it might want as far as higher calories. So the radars in your body that signal that foods is present is allowing the body to shift over to what it does best in a food restriction program, and that is to trigger a number of key mechanisms in the body, which we'll see on the next slide. So just to give you an idea what this does, they actually were able to measure key biometric parameters to reverse biological aging. And if you do 3 consecutive cycles, which is once a month, 3 months consecutively, you'll cut about 2.5 years off of your biologic age. Biologic age is something that we've been talking about. God, my kid was like 10 back then when they were talking about biological age, and he's 30 something now. So we know there's a lot of biometric parameters that allow us to get a good idea of what your true biological age, not your chronological age. We also know that if you do this over a lifetime, that you can gain about 11 years of biological age score reversal. They look at a wide variety of very complex scientific details, not so much the one you're going to get online, where you plug in your age and your lifestyle. That citation there is a key element in what the Prolon program and Walter Longo was using to really measure the outcomes. Next slide, please. So why do people water fast in the first place? Well, we know it's part of traditions all over the world, has been present for millennia, actually. And it's part of our evolutionary history. So we know that food was not very prominent many years ago. 1,000 years ago, there was always periods of fasting because there was just no food. This, we know it's included in a wide variety of cultures, practiced by 5 major religions. That's where, for example, you don't eat during when the sun is up. But we know that prolonged water fasting has been associated with repair and rejuvenation, and that's what we're all after. It's not a pill, it's a food mechanism that triggers a whole cascade of events in the body to help with rejuvenation, and we'll explain how in a second. So today we have access to food 24/7. So we don't have the opportunity to take advantage of this adaptation, which is not a bad thing, but it's also probably partly responsible for the obesity epidemic we have in our country. Next slide. So let's talk about some fancy terms. Glycogen, which is how the body stores glucose, decreases when you're fasting. Obviously, that's the body's most favorite fuel. Easiest to burn. It's readily absorbed. It's kind of like the body's favorite, but it's not exactly the best source of fuel for your body. And we know this because when you have certainly too much plain glucose in your system, that triggers inflammation. When it decreases in your body, the body goes into a phase where it starts shifting its fuel sources over to stored fat. Why is this important? Stored fat is when you want to lose fat, you don't want to lose muscle mass. And part of the mechanism for losing that, the fat instead of the muscle mass, is by burning fat for fuel. And these fat molecules are called ketones. And we get into a state that's called ketosis. Now, a lot of people have heard of the ketogenic diet, where you're eating heavy fats or more fats, in fact, to trigger the higher availability of ketones in the diet. But typically, it takes about 2 or 3 days to really shift your body's biologic mechanisms over. And everybody is unique. Some people, we've been doing weight loss since the late 90s. We know that some people do not jump into ketosis. Some people can't get into ketosis. Their body, for whatever reason, has other mechanisms that we're all not quite clear on. But when we test for ketones, they have a real difficulty turning. And there used to be you can test with finger pricks or urine dipsticks. So, but everyone's quite unique in the timing of this transition, which is very, very important in not only burning fat, but triggering all the mechanisms that we're going to talk about with longevity, with efficiency, with kind of getting rid of idling cells that are not doing anything for us at the time. And also part of that is balancing our immune system, which is very, very important in the inflammatory process that tends to be associated with so many different medical conditions that this can actually be therapeutic for. Next slide, please. So what's this big word, autophagy? It's the cellular process of recycling old or damaged cells. Now, we have many, many older or damaged, I probably have a lot of older cells in me. And that's part of the longevity pitch, is that you do have a lot of old cells that are not quite pulling their weight, but they're using fuel. And they may or may not be damaged. Just sitting there and not doing their job would count as being damaged. So this autophagy, where the body creates a little lysosomal, lysosome is a fancy word for something that disrupts the cell and basically lets the body gobble it up. It's the body's known way of cleaning house. And this innate intelligence that we had back, over millennia or possibly hundreds of thousands of years, where when food was not available, the body would basically use some of its own cells, not only for recycling for energy, but also not wasting fuel or cell function either. This is extremely important in inflammation, immune dysfunction or dysregulation, and is the primary focus of cellular regeneration. Next slide. Let's go back to slide 2 to kind of get the picture, and maybe Katie, could you go back one slide and point to what happens is follow the arrows as they move through, and these cell signaling tells the cell what to do, and different forms of cells will then go into action and gobble the cells up and digest them, sparing the cellular contents and setting it up for recycling. This was Nobel Prize win back in 2018. Okay, next slide. So what this autophagy, we know that prolonged fasting activates this. But what Longo did is he studied this intensely to find out what's the minimum amount that you need in order to get the desired result. Because shorter intermittent fast, like the big word is intermittent fasting now, which you're just not eating for a short period of time, but that will not put you into autophagy, which is the key element of this rebalancing of the immune system, cutting down inflammation, improving energy expenditure. And this several days it takes to trigger that fasting mimicking to activate is largely dependent on the individual, but typically is between 2 and 3 days. Next slide. So again, the science of ketosis, could be a very long discussion, but we're going to keep it very simple. I'm sure many of you have heard of the ketogenic diet. We're going into ketosis when you restrict carbohydrates and your body shifts over to using these ketones. Glucose is kind of like, it's not the trash molecule, but it's the easiest to use, it's readily available. It's in multiple food groups. And it's very easy for the body to utilize quickly. If you ever notice, if your blood sugar was low and someone gave you a little bit of orange juice or something of that nature, you could get back and running in 5 to 10 minutes at the most. So when this glucose is restricted, the body senses that, and it shifts to providing ketones for fuel. So why are these so important? Well, back when we were evolving and our competition was Neanderthals, who were bigger, stronger, faster, they think, a few scholars think, that the reason we actually did as well as we did is because we were able to burn ketones as fuel when our food sources became scarce. It's an ancient survival mechanism. And why are ketones so important? Well, I'll give you some individual data on that. So when you study, let's say, an animal heart, that they do studies on efficiency of the heartbeat, and they can measure all the nutrients in this solution. When you put ketones into a heart solution, that means the heart has been harvested outside of the body and is in this broth of nutrients, which they can measure and control very carefully. You will increase your efficiency of contraction in the heart by 25%. And you'll also decrease the oxygen consumption at the same time. Those are two major parameters in heart efficiency, which is remarkable. There isn't a drug or a supplement on the planet that will do this. So these ketones, again, are very, very efficient. We also know that it promotes what they call mitochondrial efficiency. Mitochondrial, they're the powerhouses of every cell in the body. The heart and the brain have the two highest levels. And these little fuel cells become much more efficient at producing fuel, even when you have a little bit of glucose around as well. The big word is called oxidative phosphorylation. That's how we burn oxygen to produce energy in the body. It's a key element for our ability to live day to day. And if you've ever been fatigued after an illness, COVID, many of us had COVID, you know that fatigue is pretty darn impressive, because we know that the COVID virus actually did, in fact, affect the mitochondria's efficiency. And that's part of the reason we even use that to help jumpstart people back after COVID, if they do have the prolonged post-COVID fatigue. Again, this is an ancient survival mechanism that we had to use, otherwise we wouldn't have survived. Now, because food's available 24/7, we are now looking at the benefits, the medical benefits of this, which are numerous. Autoimmune disease being way up at the top. They've studied it in rheumatoid, lupus, MS, Crohn's disease, which is inflammatory bowel disease, and they've also studied it in Alzheimer's disease. They found that using ketones in the brain for people with Alzheimer's had serious improvements in their standardized testing for memory. So they're also using this as a reason to avoid cognitive dysfunction in the future. As we all age, our brain gets a little slower, and they find that this is not as much of a great impact as it is normally with the typical American diet if you are doing fasting of this sort and or using ketones in your diet. Next slide. We talked about some of the benefits. Weight loss with muscle mass protection, having helped thousands of people lose weight. We used a body composition analysis to find out if after about 3 or 4 weeks, if you're actually losing muscle or not. Tends to be a bigger problem in men. They tend to be able to sacrifice their muscle mass much more quickly. However, that loss of muscle mass does not come back once you start eating, and that's a big downside of some of these fad diets where you starve yourself for even short periods of time, that you almost always end up with a significant reduction in muscle mass that's very difficult to put back on. I once had just to give you a clinical, many years ago, I had a lady who had lost and gained back over 1,000 pounds. That weight loss created a metabolism that was so efficient that this lady could strictly eat between 800 and 850 calories a day and not lose an ounce. So her body and thyroid and adrenal glands were all the mechanisms around hunger, appetite, and energy production were all so damaged by the binge and fast and binge and fast and binge and fast that she really created a monster for herself and had extreme difficulty losing weight at any reasonable level, other than there's different forms of diet. Once you get between 5 and 800 calories, that's moderate fasting. But once you're at 500 left, that's ultra fasting, basically. The second thing is you're going to have your metabolic health, like improved blood sugar, improved cholesterol, blood pressure support, and of course your blood sugar. Why is that? Well, when you trick the body goes into these modes metabolically where it says, wow, you're not feeding me sugar all the time, so maybe I can get back to having a more normal and healthy blood sugar balance. When you do eat the food, you're not as sensitive or insulin resistant. So what happens is if you eat a lot of sugar, your body has to constantly keep producing insulin to get the sugar into the cells because you get insulin resistance. Now, when you have FMD, when you do the Prolon program, you'll have a better metabolic response to food. Your insulin levels will be lower, and high insulin levels are associated with what they call metabolic syndrome, which is increased waist circumference, elevated blood sugar, elevated, it doesn't even necessarily have to be diabetic, but it could be pre-diabetic. You have elevated triglycerides and a large waist circumference. And curiously, we put in the radiant skin thing, which is remarkable because we always see it. There's not a time when someone has done either an FMD or a healthy lifestyle medicine program with us that we don't see it in their face first. Now, I don't know what, I've never heard a good metabolic explanation as to why, but for whatever reason, you can see it in their face before you even have them step on the scale. And it's not about their face is thinner. Their skin's just more radiant. It has something to do with energy and a couple other things that we measure called phase angle that just pops right up with this approach. Next slide. So the 5-day journey, we talk about why you would do this, how you slowly enter into it. You slowly reduce the calories. You have full 3 meals a day with snacks. You have and Katie will get into more of the details, but you also have a individually based use of glycerin, which is very easily metabolized, which you drink with different flavors of tea and sip throughout the course of the day so that you can maintain a healthy blood sugar. Because if you are sensitive to low blood sugar, you might find that out rather quickly when you cut your calories very, very slightly. So somewhere around day 2 or 3, you get into the fat burning. That triggers the mechanisms for autophagy, as you see in the middle of the top. By day 4, your I can't really read that. Your cellular rejuvenation starts. I'm sorry, it's really late for the old guy here. And then you start as of day 5, some renewal. Now, how did they know all this? Well, they did very, very in-depth studies. And what you're getting is the greatest amount of benefit for the shortest period of time of input. And we use this, like I said, we've used it for many years. If someone doesn't want to commit to a more prolonged lifestyle medicine program, this is frequently a very good jumpstart. If you do have medical issues, I would strongly invite you to take this once a week, once a month for 3 months straight. I was diagnosed with an autoimmune disorder back in 2018, and it was 6 or 7 months into that, and we went ahead and I found out about the Prolon. I actually spoke to the CEO of the company, read Walter Longo's work. He had just published his book. I did all the data and the research, and that's the first thing I did. And that was the single most important thing that I was able to do in that first 9 months, which was extraordinarily beneficial. And you have to eat anyway. And so we can look at the economics of that. Katie, you can talk about that. Next slide. So we talked about that, approximately 25 days in between, no more than once a month. That stresses the body. You really want to have the body get stressed and then recover. Stress and recover is the essence of all training across the board. If you've ever trained athletically, you know that you do whatever, like an interval perhaps, which stresses the body, and then you give yourself time to recover. So we know that this is across the board how the body works. And this is just one more application of that. Typically, you could do 3 to 4 cycles in a row. For weight loss, longevity is 3 times. Metabolic health, I would have to say, if you're sick, if you have autoimmune disorders, if you have inflammatory bowel disease, And certainly it might be a little difficult, but if you have early cognitive issues and have support, you could certainly do 4 times for that. And then intermittently throughout the course of the year is 3 to 4 times a year once you start the process. Now, the interesting thing is you tweak the mechanism, it's much more easily induced. Everybody reports the second and third and fourth time. And I have some frequent flyers here who typically they have one has the psoriatic arthritis. And after 3 days, her plantar fasciitis that she had for almost 2 years went away and never came back. So she was sold on that. We've had multiple reports like that. But maintenance, quarterly. This is the single most important thing you can do to help your body age healthfully, minimize the chance for inflammation. They've studied it in, I know they've studied ketones in many different cancers, which Walter Longo is pre-releasing a book now. It's called Fasting Cancer. It's on pre-order and it comes out early next month. And we've known that, excuse me, UCLA has been using this a form of Prolon to help people before and after their chemo. Now, why would you do that? You're going to prep the body to be more healthfully tolerant of the chemo or radiation. And after the treatment, you're going to facilitate recovery and help eliminate the damaged cell. So again, this basic guidelines, maintenance is basically a quarterly thing. It's super important. I would invite you, if you do have a loved one or in the family with cancer, or have experienced this nasty thing yourself, to really get his book because it makes sense. I've had a couple people do it, although the oncologists are a little bit more hesitant. I have had a number of people do that during their therapy and certainly afterwards to help them recover from the damage that the chemo and the radiation therapy has done. Next slide, please. Katie?
Take over?
Yes, please.
All right. Thank you, Dr. Sutter. So what you have to look forward to, we are going to offer the 5-day fast mimicking that Dr. Sutter spoke about at a discounted cost. Every evening for 5 evenings, we are going to log in with you guys at about 6:30. We're going to have a virtual meeting. We're going to go over each day what to expect. Each day you'll also have a virtual session with a Q&A at the end so we can answer any questions. You will have the option to watch the recorded session if you can't attend every night at 6:30. We know it's kind of hard to meet every night at 6:30 for 5 days. But it's a good opportunity to log in, see other people that are doing it with you, ask any questions you might have. Everybody has questions when they're doing these. It's perfectly, normal. Whitney and I will both be in the office Monday through Friday to answer any questions that you have. And then we also have an email address that you can contact us at directly. I know we have some questions. Give me 1 second and we can get into those. Actually, you might be good, Dr. Sutter.
Well,
Unless you got some.
yeah, I didn't get any questions yet, but if you do have questions, you can always call Katie tomorrow in the office at this number.
Absolutely.
And then, I'm going to share my screen if you want to stop for a second.
Yep.
Katie. I'm going to show you guys. There's this is on the Physician Nutrients website. You can order your kit on here if you would like to, or contact the office. This is a fast, easy way. There's 2 different options here. There's a regular or culinary, and that's just has to do with the soup flavors, which are listed here, the different kinds of soup that you get. And you can also go to Dr. Sutter's website, centerforwellnessmedicine.com. Click on education and fasting mimicking. And the slides that he just went through are right here. When you click on this, it'll bring up the slides that he just went through.
So maybe we should talk a little bit about what's in the kit. So maybe people would have questions about that.
So the kit each day, it's a different set of each box has 5 days. Every day you're going to eat out of that box. There is a soup, there is crackers. There is also, after day 2, you get what they call an L drink, which is what Dr. Sutter was discussing.
These
About
aren't
keeping-
bean crackers either, right? They're very healthful. Fiber.
They're actually delicious, and we can't get them outside of the boxes,
Yeah.
which
There.
is actually
Yeah.
interesting.
Mhm.
And there's also olives. I know that's a very touchy point with people. You either love olives or you hate olives. Prolon has just released that you can have olive oil instead of olives if you prefer. They also gave a couple nice tips that you can put them in your soups, that kind of thing, for people who absolutely detest olives, which happens.
I would add olive oil. There was a good study that was done in cognitive health that having 1.5 ounces of olive oil every day, just right down the hatch, improves a number of cognitive factors, which is the polyphenols are remarkable. So that said, that's not a bad option if you're not an olive fan.
Right. So they give options now. That wasn't an option before when I did it, and I actually didn't like olives then. Now there's a lot more options. There's more soups, different. They are gluten and dairy free.
And they have the bars, which they're very good as well.
Not during the 5 days.
Oh, I'm sorry.
Yeah, not during the 5 days, but after and getting back into it, you can use those. But during the 5 days, they're big
there a
on what
chocolate? Is there a chocolate? There's a small chocolate.
There is. There's like they call it an L bar, and it's a little tiny piece of like chocolate bar kind of. Yes. So
Right.
that fasting bar they do.
Okay, great.
Yes.
We have a question. What if you eat gluten free?
The kits are gluten and dairy free.
Yeah, we answered that. Yeah, that you will eat that little chocolate bar so carefully, and it's just absolutely delicious in that
Yes.
circumstance. So, and actually a life lesson for how to move forward, because you don't have to eat chocolate by eating a half-a-pound bag, right? You can really still enjoy it, even one little tidbit at a time. So, and this is a
They
great.
actually gave some nice tips, which I never even thought of. They said to microwave it for 20 seconds and sprinkle a little sea salt. I'm like, I mean, that chocolate bar alone at the end of day 3 is lovely. So I don't know that I would need to add anything extra, but they give you some tips, to get you through.
Right. And we emphasize that on the daily calls.
Yes. We'll start on Sunday, actually, the day before, so that we can help you guys with the prep, and then day 1 and go through a couple things. And then each night we'll do the next day. That way we're not addressing it the night of your day, so you don't have any questions.
Great. Are there any other questions?
Don't be afraid to ask a question.
If you missed us at the beginning, what you do is at the bottom, you click on the little symbol that looks like a triangle, square, and circle, and then you can scroll down and hit Q&A and then type in a question.
Well, we look forward to hearing from you if you do have questions.
Thanks, everybody.
Call the office. And this is a great tool to learn how to use. If you use it the first time with coaching, it's going to be a whole lot easier than trying to do it on your own. Believe me, right, Katie?
That is true.
Yeah, coaching makes a huge difference the first time. Once you learn it the first time, you're on your own. You know how to do it. I mean, you can still get help. We have a number of people who still have challenges with their, reapplication of the Prolon, but usually the first time around is the hard one. So we invite you to participate and learn how to take care of yourself in a very different way. You just have to believe me, because I've been doing this a really long time, and this is what works the best. So thank you for joining us all, and we look forward to seeing you in the office.
Thank you.
Bye now.